Bismillahirrahmanirrahim. Today we'll discuss cardiac tumors. Majority of the cardiac tumors are primary, and most of these primary tumors are benign. However, in 20% of the cases, uh, there are metastases in the heart from different primaries like bronchogenic carcinoma, carcinoma breast, leukemias, hepatomas, uh, tumors of the kidney, and ovarian tumors. Let's start with the most common cardiac tumor, which is benign and is atrial myxoma. That is the most commonest one. However, uh, the other primary tumors are papillary fibroelastoma, which is also called myxoma of the heart, cardiac rhabdomyomas. They are the tumors which are more common in infants. 90% of the cardiac tumors in infants are rhabdomyomas. And then other tumors like lymphoma is another benign tumor which arises in the subendocardial layer of ventricles. The other rare tumors are fibromas, lymphangiomas, hemangiomas. But the common one, the commonest is cardiac myxoma, and I think that is the most important one, and we will discuss it in detail. Cardiac myxoma is most common primary cardiac tumor. It's autosomal dominant, and it's the proliferation of the mesenchymal tissue of the heart. And if you look on the uh, picture on the left side, you can see a globular mass which is gelatinous, and it seems to be attached with the left atrial septum, and here is the mitral valve and the left ventricle. So this is cardiac myxoma, uh, the left atrium. The myxomas can also arise from right atrium, less commonly right ventricle, and least commonly left ventricle. The commonest is the left atrial myxoma, and 90% of the cardiac myxomas are solitary. These tumors do not infiltrate, and they are attached at the fossa avallis of intraatrial septum, and they are attached to the endocardium by a broad base of pedunculated stalk. And I will show you what the peduncle is. You can see the picture on the left side. This is the interatrial septum, and this is the cardiac myxoma. This is left atrium. Left atrial myxoma is attached with the interatrial septum with a stalk. And this tumor moves with cardiac cycle, so it tends to protrude from left atrium into the left ventricle during diastole, and then it pops back into the left atrium during systole. So it keep on moving with each cardiac cycle, so it can obstruct the left atrium, and will a patient may present with symptoms similar to mitral stenosis due to increased left atrial pressure and increase pulmonary venous pressure. So the symptoms of dyspnea, orthopnea, paroxysmal nocturnal dyspnea uh, may be most common. However, this myxoma can obstruct the mitral orifice during diastole, and it can lead to syncope, and it may break and can embolize to different vessels in the peripheral circulations. Uh, these patients who have cardiac myxoma, they present may have the symptoms like fever and body aches. So there are obstructive symptoms due to obstruction of the protrusion of the myxoma into the mitral orifice, or embolic phenomena, as well as constitutional symptoms. Disease is more common in females. So the obstructive symptoms, as I already mentioned, in 50% of the cases, patients, they have dyspnea, orthopnea, paroxysmal nocturnal dyspnea, and cough. Right atrial myxoma presents with right heart failure. Embolic phenomena, the patient may present with stroke or ischemia of the limb, or tumor may embolize in coronary arteries, and may lead to myocardial infarction in mesenteric vessels, lead to ischemia of the gut or splenic infarctions, and right-sided tumors, they embolize into the pulmonary vessels. The constitutional symptoms are just like the symptoms of chronic infection, like fever, chills, weakness, arthralgias, and then anemia and petechial hemorrhages may also be present. Chest X-ray in left atrial myxoma uh, gives you the picture just like the mitral stenosis. You can see the enlargement of the left atrial appendage and straightening of the left cardiac border in this patient, as well as the pulmonary venous congestion uh, due to pulmonary venous hypertension. These signs are due to obstruction of the mitral valve due to cardiac myxoma protruding into the left ventricle with each cardiac cycle. Right atrial myxoma, you can, if you suspect, you can see a mass with different calcified areas shown by these arrows. Tumor calcification is a feature on the right side. Uh, the most important investigation in cardiac myxoma is an echocardiogram, and you should see in the top left side is a tumor inside the left atrium. This is left atrium, aorta, right ventricle, and left ventricle, and left atrium, and this is left ventricle, and in between is the mitral valve. And this is systolic frame, and you can see in diastole the tumor is actually has moved into the left ventricle, towards the left ventricle, and has obstructed the left atrium. This is the four chamber view in systolic frame. This is the mitral valve closed during systole. This is the tricuspid valve, and this is the tumor within the left atrium during systole. And in diastole, the tumor has moved into the left ventricle and has led to obstruction of uh, the mitral valve. So this shows the mobility of the atrial myxoma with each cardiac cycle. In systole, it is within the left atrium, and in diastole is protruding across the mitral valve into the left uh, ventricle. And similar uh, things are happening if there's a myxoma on the right side, then it will protrude from right atrium to right ventricle during diastole. This is right atrium, and this is left atrial myxoma. CT chest shows a globular mass filling the left atrium, but it is more clearly visible in contrast enhanced CT chest. You can see this is contrast, and this is the huge tumor filling the left atrium. This is again a right atrial myxoma. It's nicely shown on CT, and you can see the calcification within the tumors. MRI shows a left atrial myxoma attached with this is interventricular septum and this is interatrial septum. The tumor is attached with the interatrial septum with the stalk. So this is MRI showing left atrial myxoma. So you should order ECG, X-ray chest for the symptoms and signs of left atrial enlargement and pulmonary venous congestion, and CT chest with contrast enhancement and MRI. These are the investigation for the diagnosis of atrial myxoma and other cardiac. The tumor has to be resected. It's very important. Once diagnosed, it should be resected immediately to prevent obstruction of the mitral orifice with a large tumor and to prevent stroke or peripheral embolism, limb ischemia, or the ischemia of the gut. For the prevention of these complications, very important that the tumor has to be removed, and the long-term prognosis is very good and recurrence rate is low. Rhabdomyosarcoma is the disease of infants and children, and they appear as masses in right and left ventricular cavities. The disease of the cardiac tumor of the muscle, and if you serially follow these tumors, they regress spontaneously and it doesn't need any surgical intervention. However, surgical intervention may be necessary in cardiac myxomas which are close to the valves and they are causing valvular obstruction. Lipomas are fatty tumors uh, which are uh, which arise in the subendocardial layer of the myocardium, and they are asymptomatic and doesn't need any treatment. Papillary fibroblastomas are again pedunculated tumors, also called myxomas of the valves, and they involve the valves of the left side of the heart. And the patient may need surgery if they interfere with the valve function. Uh, Metastatic cardiac tumors, I've already told you. Uh, uh, the metastasis to heart comes from bronchogenic carcinoma, CA breast, renal cell carcinoma, hepatoma in the order of frequency, then leukemias, ovarian carcinomas, gastric, and pancreatic carcinoma. And most of the tumor they metastasize into the atrial, into the pericardium, leading to pericardial effusion or cardiac tamponade or chronic constrictive pericarditis in some cases. And if you aspirate the um, pericardial fluid, you will find hemorrhagic pericardic effusion, and then you send that fluid for cytology. The tumor of the kidney metastasized into the right side of the heart, and gastric and pancreatic tumor can also send metastasis into pericardial space. So this was all about the cardiac tumors, and this was our last lecture. Thank you very much.